Hi guys, welcome to my channel. Today I'm going to show you how I set up my airway trolley and how I get ready to give anesthesia to my patients as a anesthetic nurse working in the NHS. So here is my airway trolley. It's just a basic setup for today that I'll show you. I just have my laryngoscope blades, eye gel. Here I'm showing you just some entails. It's just used when the patients become unconscious or asleep, and sometimes the tongue may obstruct the airway. So if you use one of these, it will be better able to ventilate them. Yes. So in the first drawer, this is just a gauge which you use to measure the amount of air that you put into the endotracheal tube, but I'll show you that another day. You have to ensure that you have different sizes of the laryngoscope blades. I will show you how to assemble it in a minute. So usually we have size 3 and 4. 3 we will use for females, and size 4 we would use for males. We do have pediatric ones, but I'll show you that in another video. So I have to check that I have different sizes of different airway equipment. So that's just a drawer of some more entails. This one is the nasopharyngeal airways. We have to check that we have various sizes as well. Usually it's sizes 6 to 8. So it keeps the airway open as well, but this one goes through your nostrils and down into your airway. This drawer has endotracheal tubes, so these are used if we're going to paralyze the patient. And when you paralyze a patient, all the muscles are relaxed and they are not able to breathe for themselves. So you have to breathe for them by putting them on the ventilator. So it is very important that we have different sizes of these tubes. They're like plastic tubes, so they goes down into your trachea through your windpipe and allows for ventilation into your lungs. We can have sizes from size 5 up to size 9. For most times, based on your weight, we can decide, but standard most times we'll just use a size 7 for a female, and sometimes we go to size 6 and size 8 for males, or size 7.5. These are eye gels. These are supraglottic airways as well. They just sit above the voice box. Most times the patients can ventilate themselves, but it's very helpful, and there are various sizes as well. These ones are called classic LMAs. They have a little inflated bulb at the end of the tube itself, so you just have to inflate it. Also with this you have various sizes. Usually I'm check that I have at least a size 3, a size 4, and a size 5. These are generally adult safe. It's safe to use for adults. On the side, that's a bougie. We use that one for endotracheal intubation. It helps to guide the tube down into the windpipe because sometimes it can be really challenging. So this is just a video of how we use the laryngoscope blades. So this is mostly for intubation. So when you attach it, there's a light at the end of it, and it just gives a clearer view during intubation. It helps the anesthetist to visualize the trachea and the vocal cords. So here I am just cleaning this machine. It's one of the older types of anesthetic machines. We do have different types, but this one is just one of the older one that we used in this particular anesthetic room. So after every case, you have to ensure that you give the machine a wipe. But at this particular morning, I haven't started anything really, so I was just like doing a wipe down to ensure that everything is clean to start the day. I am a anesthetic nurse working in the NHS, so with this position I don't particularly intubate the patients, but I'm responsible to ensure that everything is available, set up, and working well. So I work with the anesthesis. In here in UK, they say anesthesis. Here in the UK, they say anesthetist, but sometimes in I think in America they say anesthesiologist. So yes, here we use cleaner wipes as our main cleaning product. So one thing I know is that dust easily can be settled on these equipment, so you have to be sure that you keep them clean and just wipe them. Yeah, especially in the morning. So we have to clean our stuff and ensure that everyone is coming into a nice clean environment to have their procedure done. On the back there are just some cylinders. Usually we have air, nitrogen oxide, and oxygen are the gases that we use on a daily basis. So yes, and meanwhile I'm cleaning it, I check the expiry dates on them as well to ensure that everything is within date. So this is a bag valve mask. So this is just a backup equipment that we use in case the anesthetic machine fails. As I said, in anesthetics you always have to have a plan A, plan B, plan C, plan D, so on and so forth. So this is another anesthetic machine in another theater. I'm just checking it. This one is basically, it gives you the instruction as to how to check it. So you basically just turn it on and follow the instructions and just basically do what it tells you to do. So this one, same as I said, same gases, oxygen, nitrogen oxide, and air. If there's an issue, the machine will pick it up and it will highlight it, just like here it was telling me that the nitrogen oxide level is low. So I just went around and do a little manipulation and went back to check it. And then you recheck it. Yeah, ensure that everything is working well. You have the right mixture of gases and that it is safe. Yes, guys, this job is very fulfilling. I used to work on the ward before, but then I just decided to try something new. Maybe one day I'll do an advanced study to be able to do more in anesthetics. But so far it's good and it's a good learning experience. So yes, so it's just me looking and ensuring that everything is checked properly. So this pink tube here is the patient breathing circuit or breathing tube that is attached to the machine and that is attached to the patient. So I'm just checking everything that it has passed it checks, and yes, I'm happy. I'm happy with everything right here. So guys, that's it really. Thank you for watching and please subscribe. Bye.